Hello, today we will understand the glomerular filtration rate and net filtration pressure, and how it is obtained. So glomerular filtration is the volume of fluid filtered from glomerular capillaries into Bowman's capsule per minute. Its value is 125 milliliters per minute. But have you ever wondered how it is obtained? Let's see. For this, kidneys receive 20 to 25% of cardiac output, and average cardiac output is almost equal to 5 liters per minute. So that is 1,200 milliliters of blood which enters both the kidney per minute. Now remember, GFR is always expressed in terms of plasma, never the whole blood. As you know, about 55% of blood consists of plasma that include plasma proteins, nutrients, water, and hormones. About 45% of blood consists of red blood cells, and this fraction, or percentage, of blood volume occupied by red blood cell is called hematocrit. About less than 1% of blood is white blood cells, and platelets. In case of 1,200 milliliters of blood, approximately 45% of this blood consists of about 540 milliliters of red blood cells that will leave the kidney per minute because cells can't be filtered. Here we consider red blood cells because white blood cells and platelets are excluded, as their combined volume is negligible in comparison to the RBC mass. Now 55% of this blood, that is about 625 to 660 milliliters of plasma, that can be filtered. Only 125 milliliters of plasma is filtered by the kidney. This is 20% of this plasma. While rest of the plasma, which is about 525 milliliters of plasma, leave the kidney. Nothing is filtered until the pressure is applied. So, filtrate is produced when pressure is applied. Blood enters easily but exits with resistance, because afferent arteriole is wider and efferent arteriole is narrower. This creates high hydrostatic pressure inside glomerular capillaries. Net filtration pressure is the net force that produces filtrate in Bowman's capsule. It is obtained by pressure that produces filtrate in Bowman's capsule minus the pressure that force filtrate back to glomerular capillaries. Pressure that produces filtrate include glomerular hydrostatic pressure and capsular osmotic pressure. Pressure that force filtrate back to capillaries includes capsular hydrostatic pressure and colloidal osmotic pressure. Let's see pressure that produces filtrate. Glomerular hydrostatic pressure push things out of capillaries into Bowman's capsule and is about 55 millimeters of mercury. Capsular osmotic pressure pull or force things out of capillaries into Bowman's capsule. This pressure is due to plasma proteins because plasma proteins in blood produce osmotic pressure to keep fluid within blood vessels. As there is no protein present in filtrate in capsule, so it is 0 millimeters of mercury. Hence, the pressure that produces filtrate is the sum of glomerular hydrostatic pressure and capsular osmotic pressure. This is 55 millimeters of mercury. Now comes the pressure that force filtrate back to capillaries. Capsular hydrostatic pressure within in Bowman's capsule is due to the fluid is filtered that will overflow in capsule. Fluid is back up again and again pushes filtrate back to capillary bed. This is 15 millimeters of mercury. Colloidal osmotic pressure within in glomerular capillary bed due to plasma proteins. It prevent fluid from leaving blood vessels. Colloidal osmotic pressure is 30 mmHg. Pressure that force filtrate back to capillaries is the sum of capsular hydrostatic pressure and colloidal osmotic pressure. It is 45 millimeters of mercury. Putting values in net filtration pressure formula, we get value of 10 millimeters of mercury. Now comes the factors that affect the glomerular filtration rate. Net filtration pressure, any change in net filtration affect GFR. Increase in NFP increase GFR. And decrease in NFP decrease GFR. Next one is permeability of glomerulus. Suppose if one glomerulus has 4 channels and other one has 6 channels. Then the one which has more channels will have increased GFR and while the other one has decreased GFR. Here comes a condition like glomerular nephritis that damage glomerular basement membrane, making it porous, GFR increases and result in more protein loss. Then is the surface area of glomerulus. Increase in surface area increase the GFR and decrease in surface area decreases the GFR. In condition like diabetic nephropathy, protein deposit in glomerulus making it thicker and decrease SA. Combining surface area and permeability of glomerulus, we get filtration coefficient Kf. This coefficient can be used to find glomerular filtration rate by multiplying it with net filtration pressure. Here are the important correlation. Systemic blood pressure increase glomerular hydrostatic pressure that increase GFR. Increase in protein content increase colloidal osmotic pressure that pulls more water content in blood vessel. In conditions like multiple myeloma where protein level increase in blood, increase colloidal osmotic pressure. Here is another condition: cirrhosis or liver damage. Albumin level decreases. Can't hold water content in blood vessel and colloidal osmotic pressure decreases. In kidney stones, greater than 5 mm in diameter stuck in kidney. Due to this, capsular hydrostatic pressure increases. In renal ptosis, a condition when a patient stands up, his kidney drops down in the pelvis that bends the ureter. That further increase capsular hydrostatic pressure and cause fluid to back up and lead to hydronephrosis, which is the swelling of kidney.